Hello to Tracey.
Hello there.
How are you doing, Tracey?
I'm doing good. How are you doing? This is a
Yeah,
long day for you.
it's a long day for me. I'm still going. That's why I got the self-care stuff, so then I can stay
Good
and
idea.
everyone else can enjoy it as well. And we're doing something practical when we're really keeping our bodies moving and everything moving. And I kind of programmed the fascial in front of yourself really quite deliberately, and just in case people aren't aware of Tracey is the owner of Blend Therapy Training. They train people online, they train people in person. She really specializes in advanced myofascial bodywork courses. Her flagship is TMJ, and the reason it's her flagship is because she started off as a dental nurse, and we have got something like 25% of the population suffering from issues relating to TMJ, and then 20 years as a therapist. And I think, as Tracey's going to say, TMJ is not just about here, it's about the whole of the body and the ramifications that it has for the whole of the body. And so really, I'm going to hand over to Tracey now so she can do it.
Thank you. Thank you, Rosemary.
Pleasure.
Right, okay. So I've asked Rosemary how she's doing. I want you guys to tell me in the comments how you're doing. Keeping going. I hope you've all had a little bit of a break for lunch and you're raring to keep on going because there's lots of other lovely things coming this afternoon. So I want to say thank you to Rosemary and Kush for inviting me to do this. I love doing stuff with Thinktree. I've been working with them since the very beginning. So it's really great to be here. So as Rosemary started to explain, so I'm Tracey, and in a former life, I was a dental nurse for 20 years almost. And obviously that meant that I came into contact with a lot of people who had TMJ. So I had lots of experience of the condition. We'll talk a bit more about it, but just how crazy it is. It's such a misunderstood condition. The official kind of figures from the World Health Organization are 1 in 4 people have it. It's way out because the fact that it's so misunderstood, lots of people have TMJ and they don't know until they come and speak to someone who really knows about it, and then they'll say, oh, right, okay, actually, I think I have. So all those years of experience working within the dental profession, and then I became a massage therapist, and I was very much focused on clinical massage and getting people out of pain. And one day my dentist said to me, I've heard that massage and trigger points in particular at that point can be really useful to help with TMJ. And this is 2000, so this is 21 years ago. And there really wasn't anyone doing anything of that ilk with TMJ. It was just something that was starting to come through, that it might be more of a musculoskeletal condition than they first thought. And that little comment set me off on a whole path, which ended with me creating a protocol by working on willing bodies. So the dentist I worked for, he was amazing. He was very open to me, exploring this. The patients all knew me. I've been working with them for years and years. So it was a very open conversation of, you've been suffering with this, some of them for 25 years, and nothing was helping. Do you want to have a go with this? And let's see if we can do something with it. And I was literally, working with people and figuring it out as I went along. I'd got a book on trigger points. I was learning more and more about fascia. And people were just getting better. People had suffered for years and years. And that was the start of it. And that was in 2000. And then I worked, for the next 2 or 3 years, refining the protocol, really figuring out if someone has this group of symptoms, what treatment do they need? Because this is the thing. And this is why a lot of people don't realize they have TMJ. The range of symptoms is huge. And I figured all of this out. And then in 2005, I wrote my first one-day introduction to working with TMJ. And when I started Blend, which was in 2015, I then created the full advanced diploma in TMJ Therapy, which is now 3 modules. It's all online now, which is great. With the pandemic, we pivoted and we did what we needed to do, and with the help of Thinktree as well. So we're really grateful for that. And it's now a really, really successful online diploma, and it's also a qualifying course. So I created it in that way so that dental professionals who haven't got a massage background can come and do the training, so that they can. And we have dentists, and we've got a dental therapist in Harley Street using the work to great effect. Other dentists in Harley Street send their clients to here. So it's been quite a journey. And the thing is that one of the things that really motivated me from the beginning, we get into the work that we do because we want to help people. We want to have an impact in people's lives. And it's such a horrible condition. It's so debilitating. People will develop TMJ for any number of reasons. Everything from the position that they sleep in, to the work that they do, to getting a crack with a plastic cricket bat when they were 4 from the brother. Anything, all kinds of things will affect the balance of the TMJ. And the thing is that the TMJ itself, the temporomandibular joint, it's so finely tuned that the least imbalance will have a knock-on effect that just goes on and on and on. And the thing that I wanted to talk about today in relation to TMJ, the condition, is how that actually does impact the entire body. And this is something people don't always realize as well. So just to explain, the TMJ is the joint right here, the temporomandibular joint. But TMJ is also the word used to describe the syndrome, and it is a syndrome, which means that it has lots of different symptoms, as I've just said, and you might have some of the symptoms but not all. Okay, so again, we have this confusion when people are not necessarily getting the right diagnosis, because they could be diagnosed with tinnitus, migraines, tooth pain, but there's nothing wrong with the teeth. So they go through all kinds of x-rays and examinations, and they're complaining of pain in a completely virgin tooth that hasn't even got a filling in, and there's no sign of any problem. They will have difficulty sleeping, so sleep disturbances, visual disturbances, breathing issues, so sleep apnea is very common, one of the conditions within TMJ syndrome. There's so many, and one of the ones that people are always fascinated by and equally kind of disgusted by is what we call a glop in the throat. So if any of you have ever had that experience when you're really, really stressed, where you feel as if you've got something stuck in your throat and you can't cough it up and you're trying to swallow and it won't go down, that's called globulus hystericus, or glop in the throat. And that actually is one of the symptoms that you can get with TMJ. And that's one of the reasons why it gets worse with stress, is because it's actually a fascial problem and it's a musculoskeletal problem. So when I started working with this all those years ago, it was really, really groundbreaking. Most people with TMJ would, in the first instance, they might be offered to wear what we called a bite raising appliance back then, which is a mouth guard at night. And the idea of that was to protect them from grinding the teeth. But of course, remember when I said earlier, the joint is an incredibly finely tuned joint. If you get a hair in between your teeth, you know it's there, because that's how sensitive the joint is to anything being in the way of the bite. So can you imagine what it's like when you put a bite raising appliance or a mouth guard in overnight that's a couple of millimeters thick? So people would, they'd have a mouth guard created. It wouldn't really help them. Then they might be given muscle relaxant drugs to try and, because they knew that there was some kind of muscle tension there. So they'd give them Valium. Going back 20 years, that was the drug of choice. And then if that didn't really help, which it usually didn't, then they might start looking at the bite itself. They might start chopping away at teeth, replacing fillings, replacing crowns, trying to correct the bite, because the bite looked like it was off. So what they would do was they would change the teeth to try and make the teeth fit to take that pressure off the bite. And then when that still didn't work with the other symptoms that people were having, then they might end up, eventually the final resort was to send them for surgery. Now, very, very rare anybody had the surgery. The surgery had around a 5% success rate, very poor success rate. Lots of people would end up with a palsy because they would sever the facial nerve by accident while they were in there. So it wasn't really something you wanted to elect for. But that was the final resort. So people were living with this and really, really struggling with life. And trigeminal neuralgia, some of you may have heard. So tell me in the comments if any of you know anyone with trigeminal neuralgia or ever had trigeminal neuralgia. That is connected with TMJ, but for years it was known as a suicide disease because no one could help them, and no one really understood why they got the symptoms they did in the way that they did, and eventually some people would kill themselves because they couldn't get away from the pain. If I was to tell you that the muscles of mastication, the muscles that you use to eat and chew with, are innervated by the trigeminal nerve, then that might go some way to explain how the work I've helped people with trigeminal neuralgia. I've helped a little boy of 7 who was given a diagnosis by Walton Neurological Centre in Liverpool, one of the top hospitals in the country, who was given a diagnosis of trigeminal neuralgia and was going to have to be on really powerful drugs, was the only option they had for him. And his mum and dad brought him to me because I'd helped their friend. We were able, he was having 19 electric shocks an hour in his face, because that's what it felt like to him, like electrical shocks going through his face, and 2 treatments and they'd stopped. So it's amazing stuff. It's a horrible disease. It's a horrible syndrome. It's a horrible condition. Just to give you an idea, and so this is something, just to weave this into what we're talking about, what people, people have come here today to learn about new skills and so on. Some people are here because they want to know how to boost their business. Business is really important. So whilst I'm the director and creative at Blend Therapy Training, I create the courses, etc. I own the school. We also have a business arm, which is called the Abundant Business Academy, because I'm really, really passionate about helping therapists have amazing practices and have the life, of their dreams. And I know that for right now, we're all coming out of another lockdown, and for the year that we've had, that's really, really important for people to make sure that they can have a successful, reliable business. And let me tell you now, knowing about TMJ and understanding how to help people is a hell of a way to grow your practice and get more clients. So I can't remember if I've asked this question, but has anyone got TMJ? If you're watching this, pop it in the comments if you've got TMJ and tell me what that's like for you. Tell me what your symptoms are, and the kind of help that you might have had, or the kind of treatments you might have had. So just to give you an example, there is one group on Facebook alone, and it's not like a brand group or a big, doctor or anything. It was just a group that someone started to try and get people together to try and help each other with TMJ. It's got 60,000 members, 60,000 people in a Facebook group, in one group alone, who are all looking for help with their TMJ syndrome. And the reason they're all in there is because they're not getting very far. So many people suffering, so much confusion over the whole syndrome, and so much treatment out there that actually isn't helping. And there are people in that group, some of them have paid $30,000 to have a splint made and various treatments. Over in America, there's different ways that they look at treating it, and it's incredibly expensive. And then they're back in the group going, it hasn't worked, I'm really, really stuck. And the whole problem is, it's just the confusion over it. So the difference with TMJ therapy, which is the treatment that I've created, is because you'll see other TMJ courses out there and they're wonderful. So a lot of TMJ courses are to learn about the TMJ joint, what it does, how it operates, the anatomy, and so on. Our course is pathology focused. So it's all about really having a deep understanding of this awful condition and the different ways it presents, because this is why all those people in that group and around the world are not really getting very far, because everyone's completely different. Everyone. I mean, the anatomy isn't different, and the thing that starts off the problem, they're relatively common, as we said, some of the causes, but then all the different life experience and the different things that those people do, different muscles, different areas of fascia are impacted, and depending on what their personal situation is, will then help determine which of that wide range of symptoms they will then present with. So when you've got a really deep knowledge of the symptoms, and you can say, right, I know that when they present with, for example, visual disturbances and overproduction of saliva, there's one for you. So some people with TMJ will find that they drool. There's a lot of saliva and they constantly have to swallow the saliva. And I can tell you that when someone comes in like that, the first place I'm going to is sternocleidomastoid. Okay, so 20 odd years of experience as a clinical massage therapist plus 20 odd years experience as a dental nurse, 40 years I've been working with it. I know now I can look at different patterns of symptoms and I know exactly where to go with my hands in order to help those people. And as I say, that's what we all want to do. We want to have an impact in people's lives and help them. So what everybody wants at the end of the day is to get out of pain and get their life back. And as I just said, I know all its sneaky little ways. I know which symptoms are caused by what. I know how to target those individually, because every case is so different. It's just a tricky bugger. There's no other way to describe it. It's really tricky. And I'm sure those of you who've had any experience of it, and either personally or somebody that you know, or even a client, then you will agree with me. It's just so difficult usually. And the other thing I really want to say to anyone considering working with TMJ is people really go through the mill. And there are treatments out there for TMJ that are actually quite painful. And this work that I do is painless. It's light touch, fascial work. It's extreme, it's painless, it's comfortable. We're always working within the pain threshold, because one of the things you must understand if you are going to work with people with TMJ is what they've already been through. So they can't take much more. And we have to, the emotional component of TMJ is incredible. I have had so many patients down the years come into my practice and sit there. They come for the first time, and this is what happens, I think, a lot in our world, is sometimes in the UK, we're the last resort. People have been everywhere. They've been the doctors, they've been to hospital, they've been to various other allied health professionals, and then they come to the massage therapist. And it's like, well, I've heard that you might be able to help me. And the number of times I've had people come into my clinic and we're doing the consultation, and then they'll say to me, well, actually, I've now been told that it's all in my head. And one woman cried and said, I was made to feel like, in her words, like I was a psycho, that I was imagining it all, because they couldn't explain it. So can you imagine what it means to then be able to sit with that person, perform a palpation assessment on their head, neck, shoulders, and jaw, and show them exactly why they've got those symptoms that they've got? The hope that it gives to people is just incredible. So the work is very light touch for that reason. They've been through so much. We're extremely respectful, because the other thing that not many people will realise, unless you already work intraorally, is that the intraoral tissue responds completely differently to tissue elsewhere in the body. It only needs a very light touch. And when people who have not worked inside the mouth before go inside the mouth in the way that we teach them with incredible respect, they're blown away by how quickly things change. So we can make huge changes in this very, very quickly and get people out of pain and restriction, because that's the other thing about TMJ, is that one of the things that people often experience is a restricted range of motion. So that's called a trismus. Okay, so if people can't open their mouth within normal range, and normal range is around 30 to up to 40 millimeters. If you cannot open your mouth up to 30 millimeters, you are described as having a trismus. And that's what some people would call lockjaw. And with lockjaw and trismus, you can be locked closed and you can be locked open. Being locked open is pretty scary. But we can help it. We can help it, absolutely. And it's all muscle and it's all fascia, and that's what's going on. So that's why massage therapists who are appropriately trained are absolutely in the right place to be able to help people with this. Now, the thing that I really wanted to tell people about today is, you know, once you've got an understanding of the syndrome, the range of symptoms, the kind of pain they're in, what it's doing for their mental health. You know, mental health is such a huge issue right now anyway. And I just want to mention that they're actually describing that there's a second pandemic right now, and it's TMJ. There are articles in newspapers, there are articles, scientific articles being written where they're noticing this massive increase in TMJ syndrome. And a lot of it is just down to the sheer stress of the last 12 months. So in and of itself, the symptoms that people experience around the face, the head, the neck, the jaw are bad enough. But what if I was then to tell you that this is a full body problem? And this again is where sometimes people don't realize that this is the case, and they get so far with a client and then they can't get to the point that they want to be with them, and they can't figure out why. So the best way to explain this to everyone is, if anybody who does fascial work already or understands about fascia may have heard of a guy called Tom Myers. And Tom Myers wrote a book called Anatomy Trains. And Anatomy Trains describes the fascial connections through the body, so fascia is your connective tissue, that's exactly what it is. And it's everywhere. So if someone was to come along and magically make all of me disappear, apart from my fascia, I'd still look like me. You'd still be able to tell it was me. It's absolutely everywhere, and it's all connected. So what that means is that a problem in one area of the body will have a knock-on effect. So Tom Myers wrote, he created Anatomy Trains. He wrote the book Anatomy Trains. And there's another guy that some of you may have heard of called James Ailes. Now, James Ailes, he was the first Anatomy Trains instructor in the UK. He now has his own company, and his specialty is fascia and movement, and he's incredible. Now, he wrote an article for me a few years ago to help explain how the jaw, the TMJ joint itself, is directly connected right through the body through what is called the deep front line. Now, the deep front line, if you want to know what that is, just go to Google and Google deep front line Tom Myers, and a million pictures of it will pop up. And when you look at those pictures, you'll be able to see the deep front line is coloured blue, and it starts here, temporalis. It actually outlines that on the diagram. This is the temporalis muscle, the masseter muscle. These are two of your muscles of mastication. These are the most powerful muscles of mastication. Then all the way through the thorax, right through the pelvis, all the way down the legs and into the feet. That is one direct fascial connection from the TMJ right through the body, through the deep front line in Tom Myers Anatomy Trains. So for those of us who do work with fascia and who understand, there are transverse fascial planes. So fascia, and fascia is fascia, it's everywhere. But there are areas on the body where the fascia runs through, through the body. Transverse fascial planes through the body, front to back. And we know these as, for example, the pelvic floor, the respiratory diaphragm, our diaphragm here, and the floor of the mouth is another one. Now, all of those fascial planes should be relatively parallel to one another. changing the angle of one, so if one goes that way, then the other will follow. Yeah. So changing the angle of one alters the rest. So therefore, you could have an issue in your pelvis that is actually connected to a problem in your jaw. So, you know, there are lots of fascial connections from the jaw to the rest of the body. They're almost endless. James Ailes tells us that the superficial fascial layer drapes over the front of the chest with the platysma. Then a middle layer brings us to the front of the sternum with the hyoids, which are also muscles connected within the TMJ. And a deeper layer takes us into the thoracic cavity with the esophagus and the trachea. And altering any of the tension in any of these continuities will affect the jaw. And equally, it can go the other way. The jaw could be affected further down the body. So this is really crazy, powerful stuff now, isn't it? It's like, hang on. So if I get migraines and if I have some, you know, I've got a bit of sleep apnea and I'm, you know, now I'm starting to learn about it. I'm aware, I think I've got TMJ syndrome. What's that got to do with my lower back pain? Everything to do with the lower back pain. What's that got to do with the problem in my feet? Possibly everything. And this is what's so exciting and so amazing about this work and why I get so passionate about it. Because you could, so, you know, if you have a problem that started in your jaw and now you've got a problem in your pelvis, and that would be a descending problem. It started here, but it's created a problem further down the body. Vice versa, if you have an imbalance in your pelvis for whatever reason, that could cause an ascending problem. So you end up with the TMJ problem. So you have to know about the TMJ. You have to. If you're going to be a successful body worker and you're going to help people with not just TMJ, but with other areas in the body. And this is why in our training, we teach you, we have 3 modules. TMJ1 is what I call TMJ triage. That's get them out of pain and get their jaw moving again. That's the priority, get that person out of pain. And then in TMJ2, we go global. What else is happening in the body now? And we look at the entire body and we teach you how to work with that. And again, even more so in TMJ3. So there's another amazing guy called Graham Scarr, and he wrote the Structural Basis of Life. And in that book, he tells us that the TMJ causes more problems than any other joint in the body. It's the least understood with the highest incidence of associated symptomology, and it's a major cause for concern. In spite of the wealth of published research, the pathologies associated with this joint are still poorly understood, and important aspects of its mechanics remain controversial. And I can drop into the comments later for you guys these references if you want to go and learn more about this. So it's a fascinating subject. It's a whole body issue, and it could well be the missing link for your clients that you've been trying to help and getting so far with, and then you just can't quite get them there. This could be the answer. And actually, it was really funny because when I wrote my first introductory course, that was in 2005, and I had a guy on the course, and he was an Oriental body balancing therapist. It was called Oriental Body Balancing back then, back in the day. It's now called CORE, K-O-R-E. And he was the first one who said to me, you know, the TMJ affects the whole body. So I'd been working with people for 5 years and I'd created something that really worked and was getting them out of pain and all the symptoms, etc. But that one comment then set me off on a whole other journey. And that was also happened to be the year that I learned all about fascia and how to work with fascia. So, you know, we just need to really get our heads around how important this is. I'd like to get people to do a little thing if they can. Just going to throw this out there. It won't be long, Rosemary. But just to help people get an idea, if anyone has got a pencil handy, a clean pen or pencil handy, and what you can do, and obviously we can't see you, and please, if you're going to do this, you know, be very, very careful. Don't choke yourself. Don't let the pencil break and all those other safety things. Rosemary laughing at me. But if you're in your living room now or wherever you are and you're on your Zoom, I want you to stand up with your pencil, and I want you, not the sharp end, I want you to put it between your teeth on the left-hand side. Okay? Now you'll see what I did. You'll have to be able to really position it and be able to hold it firmly in your teeth. And then very carefully, you're standing up, I want you to slowly roll down so that you're taking your fingers towards the floor as if you're doing a nice, slow, gentle, static hamstring stretch. And sorry, take your pencil out. That was, I'm getting so excited about the pencil. Do it without the pencil first. Everyone get stand up and see, can you touch your toes? You can tell us in the comments what's happening for you. See, can you touch your toes? Just make a note of where your fingers get to. Then come back up to standing. Then put your pencil in between your teeth on the left-hand side, and then carefully go back down and try to touch your toes. And then I want you to notice, is that different? If it's different, tell us in the comments. Tell us what happened when you went from no pencil in between your teeth to touch your toes, and then using a pencil between your teeth to touch your toes. And tell us in the comments, as I've said, it'll be really interesting to see what people feel. But what will happen for most people, not everyone, but most people, they'll find they go several inches further. There'll be some people, like, they're a couple of inches from the floor with the fingertips, and they get all the way down to the floor with the pencil in. And everyone's like, whoa, what just happened? And it's instantaneous. And I'll tell you what's just happened. Everyone's bite is a little bit off because of life, all the things. But when you take a pencil and you put it between your teeth, you have to correct the position of your jaw in order to be able to hold the pencil in place. So when you realign your jaw deliberately by holding that pencil, that's the difference it makes to your body when the jaw is back in alignment. It's a really powerful little exercise, good party trick, but maybe not do it when you've had a few pints because you might choke on the pencil. And we're putting a disclaimer on that, Rosemary. Yes. So that's me. I've done my bits. If anybody has got any questions for me, put them in the comments below the video. I'll be on and off all through. I'm always on and off Facebook. I'll come back in even tomorrow and answer your questions. And if anybody wants to contact me, if they're interested in anything that we do, then just drop me a line, drop me a message, and I'll be really, really happy to talk to you. Thank you.
Wonderful, thank you so much. Jane has just said, without the pencil, she could go just below the knees, and with it, she could go almost right down to the floor. That is the difference.
I love it when a plan comes together.
Yeah,
it's real. It really happens.
But she also says by the left side, so definitely. Who wants to know? Jane will be on at 3 o'clock as well. Just by the way, everybody, which is fantastic. Tracey, thank you so much for that. And more people need to know about this, and more people need to know the difference that working with the fascia makes to the whole functioning of the body. And as you said, deep front line.
It's our core. When people talk about the core of the body, if you guys, go, if you haven't already seen it, go and look at the diagram of the deep front line. You go, that's the core.
Yeah.
Psoas, the pelvis, everything. What we think are our thorax. It's everything. So, yeah, it's good stuff.
And thank you so much for coming on board. And as Tracey said, she'll be there. Just put whatever questions you like in Facebook. She'll come back. She'll keep an eye on it. And maybe if you pop your page on there as well, Tracey.
Cool.
So people can find you.
Thank you.
And you take care, Tracey.
Thank you, lovely.
Yeah. Bye.
Bye.
Okay, so at 1:45 we will be back at 1:45 with the lovely Laura.